Perfect. Thank you so much. Well, it's a pleasure to be here with you this afternoon, and excited to share some of the work that we're doing. And it's always great to hear from others around the nation and the work that you're doing in the same space. So it's always great to be able to come together as a group. And so really excited to be able to share with you today. So, and I don't think I have control anymore over the over the screen.
Sorry, Celeste. I'm
It's
gonna
okay.
go ahead and control it for you.
Okay, no worries. All right. We can probably move past, we can probably go 2 slides since Melissa did a great job of introducing me. My next slide is just a little bit more about me. But I think what is always really interesting is the role that a chamber of commerce plays, right? And so one of the things that I like to do is talk about our mission, because I think it's really what drew me into moving from higher ed into this workspace, because I still get to work with within education, but really looking at it from a regional perspective and being able to look at my community first and foremost, and in a broader lens too. But our mission here at the Chamber is to it's to initiate, advocate, and empower our region to advance a prosperous business environment. And the reason I like to bring that up is because we purposefully put region before business. And that's not usually common with a Chamber of Commerce because we're supposed to be that business voice. But when we think about it, if our region is thriving and the folks in our region are thriving, then our businesses are going to thrive as well. So it's important for us to think about what are those key things that make a region really economically stable, thriving, growing, and doing all of those things that it needs to be. And education is always going to be at the forefront of that, right? Because that controls and it gives you that access into the workforce and making sure that what you're doing within your area really does translate into being able to keep and develop the workforce that's needed and that has the skills for the employers within the region. So for us, that's really important. And so I think that's, why I always like to talk about what our mission is. And you can go ahead to the next slide.
You have control now.
Oh, do I? Oh, perfect. All right. So one of the things that I also wanted to bring up is that we've always been in the educational space, but through different lenses. When the EDA released the Good Jobs Challenge grant, we worked with some of our partners to move forward and go after that, and we received one of them. And so we got $8.5 million to look at our healthcare regional training system. And so when we first went for this, there was a couple of things. And for us, equity was really important too. When we were applying, we were coming out of COVID, and so really the reason we focused on healthcare, one, it is a major industry within our metro region, but 2, we were able to, COVID put that spotlight on inequities that we always knew were there in healthcare, but it just, made it bigger, right? So we looked at that. We also looked at some labor market information and we did some trending. So we used some data behind that and we looked at our numbers within healthcare jobs and we separated those out. And what we found were that in the lower level support jobs, there was good upward trends of diversity over the years. When you look at the higher wage practitioner jobs, our diversity actually went down. And that was one of the few areas where diversity trended down when we looked at jobs over a trend line. And so we knew that it wasn't for the lack of people, and talent available. So there had to be some other reason. And so we knew there was opportunity there. And so it was important for us to think about that. And so as we wrote our mission for the work that we were doing around there, you can kind of see like we really wanted to think about having inclusive, equitable growth. That was really at the forefront of anything that we were doing. And it was it's kind of, it is the driving factor. So let me move over. So when you look at the objectives of what we were trying to do, it was to pull together, a sector partnership that really identified, skill gaps, any type of barriers that we had. And we really were looking at promoting resiliency through jobs that could really provide a starting point for somebody's career, but also had mobility upwards. That was really important to us. With this grant too, it's a shorter term grant. And so we had to think about what could we do that would be of most value. And so we really wanted to focus on pathways. That was really key and critical, because what this grant provided us was an opportunity to remove a lot of barriers, whether it was cost to training, whether it was barriers that people typically have when it comes to work and or education, which could be, childcare, transportation, other fees and costs, you name it. Those things are things that affect most people on a day-to-day basis. And so as we thought about this, we really wanted to think about how could we get somebody into the healthcare track as a starting point without incurring costs, and then have the ability to continue to move upward. And that was going to be not just, one entity that was going to affect that. We knew we had to really build our partnerships and think about how this was going to live and be sustainable long term, even after training was done and or in between when people try to move up within their careers. And so it was important to bring employers along as well, as we developed this, because it was never going to work if that wasn't there. So let's see. I think what's really interesting too is that we really wanted to take data to really lead this forward. And so what we did was we combined two frameworks. We used something called talent pipeline management that comes from the US Chamber of Commerce Foundation, and it's brief, demand-driven, employer-led approach to closing skill gaps by building pipelines of talent that align to the industry needs. And so really that's where we started. When we looked at this grant, it really was about sectoral partnerships. And, if between us, I think really what the focus was is that when the WIO reauthorization came out and they mandated sector partnerships and there was no funding towards it, there was some success, not a lot. And to run sector partnerships, it takes more than just mandates, for it to happen, especially for it to be successful. And so this funding really allowed to put some money behind that to really explore what that could look like if you give it the attention that it needs and if it could be successful. So looking at Next Gen Sector Partnership, that was a framework that we had already been utilizing within this region. And really, when you think about it, it's really bringing all the right people together to help drive decisions. The reason we adapted this is because when you get all the right people in the room to try to move something forward, for instance, healthcare, like we were looking at, I think you get the people that are there and they know that there's issues. They can state the issues. They can state, here's some real needs that we have. The hard part then is activating how to make things happen and how to keep it going. And I think that's where it kind of would fall through sometimes. You have that, and then you also have turnover. And so that always made a difficult place. And we work closely with our workforce boards as well. And that was an area where they said they had a hard time bringing industry to the table and keeping them engaged. So we thought this is a really great place to marry these frameworks. And so we started off with the talent pipeline management framework, and it was really based in data. So what we did is really started with employers, because if they're not willing to come to the table and understand their needs and prioritize and put the effort into it, we were never going to get anywhere, because they're really that driving factor, and they're the employers at the end of the day, and we have to make sure that they're taking ownership too of this process. Because you could always go back and forth and, point fingers, blame, folks, but if you're not working together, we're never going to fix anything. And so the framework behind this is really, one, organize your employers, right? Then we did some demand planning, and I'll go through all of these in a little bit more depth. Communicating the competencies and really getting them to center around them, analyzing talent flows, building talent supply chains, and really this was really it's a supply chain model, right? You look at the demands, you look at the issues surrounding it, and then you come together and try and fix where there are leaks. I think the other thing it also focuses on is that it's not that there aren't pipelines in place. There definitely are. We have great providers. We have great K-12 systems. We have great higher ed, technical colleges, and other partners who have systems in place. We just have to find out where the leaks are in those systems. And that's really what this does. And so having that data really helped bring people along. And so, for instance, when we started bringing them together, go to the next slide, we started collecting real numbers. You could always look at labor market information, and we always did. We did that first just to make sure we were headed in the right direction. But the beauty about this is getting true numbers and understanding those true numbers. So when I brought our major employers together, and what's really important is that I started small with numbers, but as far as how many employers total that I brought in, because it really is like herding cats, and to get the right people in the room, that's a really difficult thing to do. But I also chose the employers that had highest numbers. So we had our 3 major hospital systems, and then a couple of others that we chose specifically for equity components. So we had a nationally qualified healthcare system, and then we also had an assisted living, just to diversify in some of the jobs that we were looking at, but on the larger scale. So I did that on purpose so that we had a true idea of numbers, and it did trend right with labor market information. So it told me that, even if we were able to bring other employers that were maybe smaller, it really wasn't going to change the numbers drastically and point that we were in the wrong direction. So when I first brought them together and put them in the room, I wanted to test that theory, and we did. And there's some resources that Diamond's going to share with you later so that you could see kind of how I did that in real time of first bringing employers together. And we really just anecdotally talked about what are those issues that you have, what do you think are the highest pain points, and what does that look like for your organization. And we had the heads of HR that were with us, and maybe a couple of people from their team. And they came together, they worked through this, and then we kind of cataloged what they thought their top needs were. We also looked at, what made a good employee, what are things that you think are important as far as skills. Then their homework that night was it took more than a night. They went through and I provided a framework of what the survey that produced those results for you. So you'll see that too in the resources. They went through and actually took their real numbers. So we looked at open positions and whether they were for, replacement because they were being upskilled, which was important for us to look at as we think about that equity and we think about those pathways, and or if these were new positions, or if somebody was leaving out of the industry altogether, or retiring out. And so you'll see they were able to provide true numbers. The good thing about this too is that if you're looking at new jobs, it's very different than looking at replacement jobs, right? Because that's going to tell you a different story. If everybody's leaving industry, that could be for a different reason. And so that's something that you'll have to address. And so when you have data that's really useful, you can really decipher what's happening. So I say all this to say, when we first started and they chose their pain points, it looked nothing like the list that you see of these numbers. And so when they got the true data back, they were like, well, maybe we need to rethink what we thought. we knew. And so a lot of times you'll see that disconnect, especially with heads of HR. They may not have the true numbers. They might have somebody who's in their ear saying, this is really high priority. This is something we're hearing. And that definitely was the case and something that we saw. So taking true numbers like that is really helpful. Oops, we went the wrong way. Sorry. And it really helps the conversation. The next thing we did was get them to come around the idea of, we have to start thinking together and come to consensus around these jobs. And what came out was exactly what we saw. We would have one job that had different names to the same, SOC code, right? That wasn't helpful. It's confusing across the board. Sometimes they did it because it was we wanted this job to sound sexier, so people would want to take it. So, we changed the name of it thinking, that'll cause, people to want to be in these positions. And so there's, all sorts of reasons why somebody why these things happen. But we also found there were some things that were the same, and you can see here, there are some things that were different, and we really wanted to, for the benefit of opening up a talent pool and for the benefit of our education and training partners, to get them to come to consensus around these things. When it comes to what the, minimum education, minimum certifications, the experience, and all of those things, we wanted them to come together around that. And especially when you think about certifications and things like that, that's something that, again, can be cost prohibitive for people and become a barrier. So we wanted to make sure we didn't have participants, students going through programs and, not getting the right certification, especially as you think about pathways. If we started thinking, just for this one job, we would have got a very different outcome of what some certifications, we would have chosen. And maybe it would have been because of cost. This one costs less. It's acceptable for this job, but is it going to be more expensive in the long run for that individual who's trying to go through a career path? So that was one thing we really made sure to think about as we looked at career paths and thinking about certifications that could go further for individuals and not just something that was this job necessary. And that really, focuses in on retention for employers. And so we had to push that a lot, and really dig into why certain things, are a certain way. Now, you're always going to have outliers, and that's okay. And one of the things that's important to notice is that when we did this, we're a neutral party, and I'll explain more about that later. We also aggregated this information, so nobody saw anybody else's information. They just saw the total information. If they were an outlier, they knew they were an outlier. And so then they can see kind of these averages and based off of wage, they could understand if they were in a good position or if they were under the cut. Within healthcare, you have different ratings for hospital systems, and that changes sometimes the certifications that they might use. So we were okay that that one hospital system was a little bit different. We acknowledged that, but we took what consensus there could be around for the needs of the most of the employers. So that's just one thing to notice or to think about. You may not get complete cohesion around things, but that's okay. I think as long as it makes sense for the larger community, it's completely fine. The next thing we did was we brought together, and here's the important part too. When I mentioned the HR heads not having all the right information, usually when you pull a partnership or together and you just bring everybody together all at once, sometimes you don't have all the right people, and it's a lot. And so we really wanted to be thoughtful around, one, it's so difficult to schedule time as it is. So to not have the right people in the room is difficult, and we didn't want to overtask people. So when we pulled this together, we didn't bring everybody together at once for the first time. We really segmented it out. So we worked with our employers first, and then simultaneously pulled together other groups as needed until we got a lot of the data together to make those larger meetings more powerful. So when we started looking at certain things, we would bring in whether, not just that main HR person, we would have either a hiring manager or supervisor, so they could really give us some key critical information. When we brought together our training providers, we brought in those same folks, whether it was a supervisor, hiring manager, and then we brought in deans and faculty to really then discuss the curriculum. And so we looked at capacities, we looked at clinicals, we looked at how they recruited, we looked at success measurements, and we also, were able to line up the feedback and everything else. We, pulled all this information together to make sure that our training providers were, up to date with everything that we were looking at with the employers and their needs. And so that was really helpful to get them together to talk through these specific things. And we also had that information from the employers, to go through with our training providers. One of the things that we saw too is that sometimes, when there's policies that can affect licensing and credentials, sometimes employers and educators are not on the same page. And so when you're not actively talking through a lot of these things, there could be misses along the way. And so it's important to have the right people talking about the right information. So for us, this is just a document that we do as well, looking at our career pathways. When we used all of this information, we really were thinking about how can all of this kind of sit together and how can we build out these pathways. That was really important for us, like I said before, because equity is kind of first and foremost of how we wanted to set this up. We didn't want to just look at one job and just tackle one job at a time. We really wanted to think about how do we provide for folks wanting to enter into this career and have that mobility upwards. The other piece that we really worked with employers on was really thinking about here are the needs that we're seeing. How can you, as an employer, pick up after, training lets off? Because just because they're in a job doesn't mean those barriers just magically go away. And so that was something that, was really important for us to really stress and continue on. Just because now I'm working doesn't mean it, it has impacted me enough that I don't have childcare issues or transportation issues. And so really pushing employers to help provide answers to those solutions is valuable, and having them there. The other piece is that, for us to take the ability to pay for training, and the same thing when you think about WIOA funds or any other funds that you can assist in training and bringing people into careers, is that how to help them and, get to that next level. And right now with the labor market the way it is, retention is really important. Employers are looking at that. They understand retention is important. And so building in a advancement plan for their employees is something that's not, it used to be a little bit more difficult. Now we're finding a lot more. There's readily employers who will provide tuition reimbursement for continued education. And that was something that we really talked about, especially to make these pathways continue to move forward. So once we got all of that information and we pulled the right people together, that's when we pulled our kind of larger sector partnerships. That second framework I talked about was through Next Gen Sector Partnership, and that's kind of what this model looks like. And here you can see kind of who our main folks are. And when you look at that piece on the right, there's an equity council. What we did, especially because we really wanted to make sure that we were thinking about that and keeping equity at the forefront, because our values were to be equity centric, was our first one. We brought together this core group as we started building out this framework to really look at the work that we were doing and how we were setting it up, and to make sure that we were thinking about things with an equity lens. And so there were people that we knew were going to be part of this sector partnership, but we wanted them to be used in the right way while they were waiting for this larger group to come together. And so we really did that at the beginning, is really, being intentional about what we were doing with who and in the right groups at the right time. And so as this came together, this is the larger group. The other piece that, so when we talk about us being this neutral partner, or neutral party, I think that was really important, because a lot of times, people want to work together, but it's hard to get them to really work together in a way that brings everyone together. And so when you think about training partners, we have, a few training partners and providers, and naturally they're kind of in competition with each other. The same thing with employers, they're kind of naturally in competition with each other. We have some folks that do wraparound service from a state, with funding, to private side, that are also sort of in competition with each other. And so having us as this neutral party to kind of bring people together, I think made it a lot easier for folks. And we were able to, especially with employers, sit there and really talk about, when it came to even salary points, why in this field are you wanting to, only pay this much, but you're putting this upfront burden on participants when they can go down the road to this manufacturer and make a lot more, with the same, experience and or degree things. And so having kind of that outside neutral voice sometimes is helpful. Sometimes it can get me in trouble, but I think it's great to be able to push back, right? And be able to have people think differently about certain areas, because a lot of times you get into that mindset, it's, yeah, we want to keep going, or, I'll have employers say, well, if I could just get all of these, these schools together in a room, we could fix this. And I'm like, well, who's driving it? Are you driving it? Are they driving? Who's going to really make sure that happens? And so having somebody who can really convene is really important, I think, within having these partnerships being successful. The other thing, and this kind of leads to a little bit of your framework when it comes to equity, and how we made sure when we looked at in community engagement and we used that equity council, we really wanted to make sure that as we were making decisions, who were making these decisions? Was it the top leaders in these, hospitals and wherever, or, doing the same thing that we think is needed at all times? Or do we really want to start talking to individuals that we think, are who are we're trying to affect, and make sure we're doing it the right way? And so that was really important for us, is to get that community engagement and really understand the needs, because we can take, information that we know or that we think is the right information, but if we don't really talk to the people that we're trying to affect by this, we're going to have a miss. And so we did a grassroots kind of community engagement campaign where we really didn't even advertise. We just used our community partners. We surveyed for 3 weeks, just through word of mouth, our community partners, and received over 1,200. Our goal was 2,000 participants in a survey. We got over 1,200. We hit our goals on our focus groups and community forums, and we got really valuable information from it. One thing that we did was looked at the incumbent workers with the employers that we were working with, and looked at what they thought their level of career advancement opportunities were. This was really important for employers to see, because they could say, oh, we offer these things, we do these things. Do your employees truly know that? And so we gave them kind of a baseline of what it looked like for their employees. We also looked at, what motivated them to seek their job in healthcare, so that they could understand really what was important to their employees. And we took this information and then broke it down for each employer, so they had their own information of their employees. When we looked at our overall population of people who were taking the survey, we really wanted to understand, especially as we looked at wraparound services, because when we did this and we really first thought where we were going to have the greatest need of money put in, was we were thinking childcare. When we surveyed, it really wasn't as high as where we thought it was going to be. So it was really good to see and talk to people to understand their needs around this, because where we thought some things were, they weren't. And so that was kind of enlightening for us. We also looked at, when they're applying for a job, what are they considering? Just to, validate probably things that we kind of knew, but it was good to have it there. And with our survey too, we were seeking a certain, the population that we wanted to hit, and we did hit that target. So the people that we surveyed weren't, people that probably weren't going to want to be in this. So we really did hit the target that we were aiming for. We also wanted to know their familiarity and interest in the jobs that we were looking at. So that was important too for us to understand and make sure that we were highlighting and we were able to recruit the right way. We also looked at motivation and participation in a training program, and what motivated them or not. And then, really when I talked about bringing people together, one of the great things of what we're able to do right now is really, because we're bringing people who have been in competition, we're able to open and expand what we're doing a little bit more. We are working as a co-enrollment program. So the grant that we have, we're blending with WIOA funds. We're also bringing in a private partner as well with unrestricted funds who sits in this space also and does wraparound service and can do training as well, but without the restrictions that we have. So with federal funding, neither of the other federal funding sources could provide towards housing as a barrier, but our private partner can. And so we're really harnessing in, instead of thinking about, duplicating and going, shorter distance with folks, bringing everybody together to really maximize what we're doing so that we can help more people complete through programs and get into jobs. And so for us, this is a great long-term model that can easily be sustained as we start thinking about, how do we keep this going? I think the other great thing too is that when you start looking at policy, we were, as a chamber, we lobby and advocate for policies that make sense for the business community. And so we had a statewide Workforce Development Act that we were helping to push through, that we were following really closely as well. And so the other kind of great thing about working with a chamber is that you kind of have that ability to have more hands in the lobbying piece of helping to affect policy. And especially as you think about, if something were to come down through licensing or issues around there, we could also help push, towards what makes sense to help move policy initiatives forward. So that was a lot of kind of our framework and what we're doing. So really wanted to open it up now to kind of questions. And I know, I'm a chamber and you all are community colleges and education focused. And so, but I wanted you to hear kind of the framework and why we were sitting in that space. So I'm sure you probably have questions now too about that.
Jump in really quick. I just want to give a personal thanks to Celeste. We met at a conference, I think it was NSC conference, and we're sitting together at a table talking about work in the southern region of the country and reconnected. And I said, you'd be great to have as a speaker. So I want to say thank you for coming and accepting our invitation. I do have one question. A lot resonated with me when you were talking about data and using data to inform, and it's right up our line of work. One of the terms we use is hunches. In some work, we work with community partners, and they'll have this thoughts because they're in the work every day. And there's these hunches or thoughts about what's happening with programs. And we call them where the leaks. So a lot of resonating language that you used in your work. And I think it's very helpful. But using that data, getting to the real whys, why things are happening that way once you have the data is really helpful. So I wanted to just ask a question about, as you're collecting data, where are some of the other data sources that have been helpful for you to collect data beyond employers? Because you'll get one set of data that's informative, but sometimes you have to drill down and ask other folks who are part of solution to really understanding like why maybe some of these drips or gaps are happening.
Yeah, absolutely. We definitely utilize our partners, especially in the workforce development. They always have their hands, right on and collect. And usually will find they're willing to share that information. So they know, especially when there's separations with jobs, they can kind of find that information a little bit quicker, especially because, you know, holding unemployment and things like that. So you can utilize them to find some of that information. We'll always do that, especially they'll, you know, be able to compile stuff from, I mean, you can go to the Bureau of Labor Statistics and pull information there. We do that a lot. We'll do some trending that way. And you can also utilize that for looking at diversity within jobs. And so there's a lot of different sources and areas where you can kind of gather this. I also like looking at geospatial platforms where they have it really broken down on a map, because we're a tri-county area. And so some of our counties are really large, and that doesn't give you a good story of what's happening, especially when you're thinking about transportation or childcare, especially if there's deserts of areas, because that can really tell you a little bit more about the story of what's happening. And so that's one thing that we're really being cognizant about. I think also too, you know, we're in South Carolina, and so we're in a state that is also kind of, they're looking at DE&I efforts. And so as we think about how do we still move the work that we know we want to move forward and not get caught up into some of these things, using place-based information is, I think, is where we're leaning into, and really looking at, you know, poverty areas, deserts, you know, because that's going to show a different story than just, oh, anecdotally, you know, only the numbers seem okay, but it's only okay for some people, not everybody.
Thanks so much for asking that. And I was going to say, you know, listening to Celeste, I saw so many ties to our success elements, data being one of them. Another one is really around the whole aligning policy and practice, and of course, engaging and cultivating business partnerships. One of the things that's come up among our ACE Up members is this whole notion of, you talked about the barriers, and how you raise those conversations with your employer partners, because that can be challenging. And I'd actually love to bring Melissa into this conversation as well, because Melissa, you've been on this, in this group and doing this work as a community college member as well. So maybe if the two of you could sort of talk about that a little bit, that would be really helpful.
Celeste, do you want to start?
Sure. So one of the things for us, especially when we think about pushing employers and talking about barriers, is that depending on who you have in the room, right, it's going to be really skewed. And I think for us, when we started looking at average salaries, and then, you know, because they get so, when you're in that HR realm too, you start thinking about salaries, and you're not thinking about an individual person. You're thinking about what's our overall capacity? How do we expand? How can we do this across this range? And so you have to bring it back down. And so when we did that, and we had the numbers, you can start pulling and making it more personal. Here's what your starting wages are. This is what this looks like for somebody on a yearly basis. If you look at, you can start extrapolating. Here's the median average housing cost, or this is what the cost burden is within our, you know, region. How much of their percentage of their income is going to have to pay for that, you know, and not even mentioning, you know, adding on, you know, we do 30 for housing, 15% for full transportation, and then where are you left with to then cover, you know, your pills, your groceries, childcare, all of those things. And so how is anybody going to be able to do that effectively and do that with one job? They might not be able to. And so if they're having to pick up multiple jobs, how are they going to then get the training to advance themselves? Mm-hmm. And so, you know, you do have to bring it back to that. And like I said, when they were looking at, you know, a certified medical assistant, we're looking at the cost, and they're like, well, we're not going to take them until they have the certification. How much does the certification cost? How much do their, you know, equipment and supplies cost? And you want them to take this upfront for this pay. Meanwhile, Volvo's right here, who's going to pay them this much more and give them these benefits. So, you know, explain how you're going to incentivize people to want to do this and stay within this field. Mm-hmm. And Yeah.
And we have very similar conversations. You know, I've got to say that I have been here at the college for 33 years now,
Mhm.
and I've been working with our K-12 systems for decades. And in that space, really became engaged with the Chamber of Commerce
Mhm.
because our Chamber of Commerce really did serve as a convener for educational initiatives and talent pipeline development
Mhm.
for years. And so we really became engaged more and started having more open and robust conversations. The other part of that is we are not just a community college, we are a community college, but we're also a technical college, which
Mhm.
means that we deliver workforce training programs that are supposed to meet the needs of our region. So
Mhm.
we work very hard to do that. We have advisory committees, as many of you do, or all of you do probably, sitting on top of your programs, telling you what it is that you need to be doing in those programs. And so we're very, very responsive. And still, sometimes that communication is not strong enough and you miss the mark. A good example, we closed our pharmacy tech program a few years ago because the big box stores started doing the training, and why was a student going to come and pay the tuition here when they could get a job there and be trained in-house? But what we discovered after doing this is that our hospitals were dying, absolutely dying. And so Medical University of South Carolina is one of our biggest employers, and they approached us. Some of the others began approaching us as well. And we started having conversations with them about reopening this farm tech program, which is a big deal. And with that conversation, we started a joint oversight committee. And we started pulling in the right people from the college, because what we discovered was much of the conversation and the issues were happening at a much lower level, at that clinical experience level. And they were not percolating up to the top levels who could really address the issues. So now the top levels are sitting at a table and we're bringing the people in and we're saying to them, you have to say this to the other. I know it's an uncomfortable thing to say, that the students don't want to go to their clinical experiences because they feel mistreated, and this is what you're getting in the evaluations. But they can't fix that unless you say that to them. So we're having very honest conversations. And with the farm tech, one of the issues we said is we really can't build a program again to produce students when the pay is so low that there's not a family sustaining wage here. So how do we create a ladder of progression for upward economic mobility for a student who comes in? How do we build an apprenticeship program with you that allows you to hire somebody at this lower level and pay them at this rate? And so the hospital, and then move to the next level, so on and so forth. So the hospital did a huge market analysis of the whole southern region and raised their pay scales and created level 1, level 2, level 3, all the way through. You can even go into our pharmacy program and become the pharmacist after you've taken this body of coursework at the college, and we will accept you into the pharmacy program with these courses completed and your experience through this progression within the area. So now we're doing radiology and respiratory. And the whole time we're having these honest conversations, I'm referring them back to the chamber and saying, you know, they have this EDA grant, and are you having this conversation with them? And here's how we can reach these students. We're looking at our student populations and we're saying the students we most need to reach are the ones who can't afford to go to this training unless you employ them over here. And we partner with the chamber to get these wraparound services that are being provided through these external parties. And so it becomes a whole collaborative community project. But you have to be willing to have those hard and honest conversations and be able to say to the other, let's create a body at a higher level that is going to bring the people in and say, this is a safe space to say what you need to say. But we're making real traction with that. You got to be honest.
Yeah.
We also are very cognizant of the fact that we are not competing with our K-12 systems.
Mhm.
You know, in so many areas, I hear that there is this competition. And so they don't want to share employers with post-secondary. We don't tell you who our champions are at this high school. We don't have that here. You know, we are trying to collaboratively to build seamless educational pipelines. And so we're engaging employers with those high schools while and building out a pipeline that sends them through us and on to higher
Mhm.
levels of education. And one of the ways we've done that is through the youth apprenticeship program. And once again, when we were asked by a local manufacturer to start a youth apprenticeship program because Boeing had come to town and they were desperate because everyone was pulling all of the skilled labor, or Boeing was pulling all the skilled labor away.
Mhm.
We could not have started that without reaching out to our chamber and saying, tuition is the issue here, and we can't make this equitable.
Mhm.
And so from the outset, the chamber said, we will raise the funds. And initially they did. Well, now it's unsustainable for the chamber to raise all the tuition dollars. But they did initially to get us launched. And then because of the success, we were able to pull down lots of other funding sources. And so now it's a braided funding. You have to build it collaboratively in order to make that happen. And competition doesn't work. Even in terms of us talking with the employers, like MUSC started this whole conversation with them, but we're getting pulled by the other hospitals. And I had to say to them, okay, you have to let me share what we're doing over here.
Mhm.
And let's see how we can bring them into this conversation. Otherwise, you're going to just keep pulling back and forth, raising your wages and pulling back and forth the same pool of people without bringing new people into this talent pool who can really help us accelerate our goals.
Mhm.